I am going to try to keep to time, but I feel like I could, pepper you with questions for hours upon hours. But one of the things I am most excited about when we're talking about AI and emerging technologies is just within the healthcare space, advancing longevity, all of the fun medical breakthroughs that we're already seeing. But it also introduces some really profound risks from suppliers, from the patients themselves. And I wanted to start off with just a baseline question of where are you guys at in the space of how do we balance innovation with safety in the healthcare space? Which way do you lean more towards? Frank, you want to go?
I was pausing to wait for Rob to chime in.
All right, either one.
I can start. I'll just jump in here. I worked in healthcare for quite a number of years, not on the healthcare side, not on the business side, but on the technology, IT, and security side. And there was healthcare, to be honest, tends to move a little bit slowly as an industry, rightly so, because of all of the downstream impacts ultimately to safety and to patient care and health and so on. And as a result, but despite the fact that healthcare moves a little bit slower, I have never seen a situation where over the arc of time in near to medium to longer term, every healthcare organization adopts technology, whether it be the web back in the day, whether it be mobile, whether it be cloud. And now, of course, it's going to be AI. Now, when is that inflection point going to come? We can talk a little bit more about the different areas of healthcare and the different business impacts and so on. But yeah, I definitely lean more towards the innovation side, but needing to do it in a measured approach. Absolutely.
Yeah, Rob.
I'm definitely on the innovation side. I'm doing a lot of just listening behind the scenes. I'm a big Peter Attia fan of the Drive, David Sinclair. You mentioned longevity. There's a lot of innovations coming, especially for preventative healthcare, that I think AI is really going to open up for, everyday, capabilities at home. Tend to agree with Frank, with some of the back end slowness of the overall process. I think some of that could be improved from, what they talk about human trials, having to shift some of that into potentially modeling that's out there. But because of the sensitivity of a lot of this data, some of the most private data that's out there, much more sensitive in many cases than what you end up finding financially, I think there's a massive amount of concern over what data leakage might look like as healthcare research facilities and more end up tapping into these new capabilities and this new technology.
Yeah, fully agree. I too lean more on the innovation, and I think of a quote that Stephen Northcutt used to say, where it was something along the lines of, the safest place for your laptop is at the bottom of the ocean, but that doesn't help anybody. And I think that's where we're at too in this space. So was listening to Russell and James talking, and they had mentioned HIPAA has not been updated in a long time. And so I took a quick look at the last time they were updated, and AI is not mentioned explicitly in HIPAA at all. And one of the things that I just quickly glanced at and realized, biometric data and biometric identifiers, those are under HIPAA's guidelines of, one of the 18 identifiers that are regulated. When we're now seeing all of the biometrics coming with the age of AI, trying to prove that you're a human, when you're doing these things, and that is one of the top on the list. Do you like using biometric identifiers in the technology space, or is that something that you think should be deeply protected?
When we talk about healthcare is a broad area. So I try to simplify things. There's care delivery. There's the process of going to the hospital, doctors and nurses, care providers, delivering care to the people that need it. There's the insurance side in terms of needing to charge people the right amount and pay for bills and so on. There's the research side, which could be a lot of personal medical information. It could be pharmaceutical research and so on. Now, I think we all know that AI is going to help all of these various areas in ways that we've even yet to perhaps imagine. So related to what you were just saying, Kate, if we think about care delivery and the insurance side, what's one of the big business impacts? It's like our job is to figure out, understand what the cyber risk is. Therefore, we need to understand what the corresponding impact is. You mentioned biometrics, but hey, we've seen many times over the years is fraud, is medical fraud, is people pretending to be, their cousin because they don't have healthcare coverage themselves, trying to get access. And we know that there's, deep fakes easier to do from a voice recognition, bypassing voice recognition, things like that. And so I think it's just going to be a game of cat and mouse. And ultimately where it boils down to is that both from a defensive and from a beneficial perspective, AI is going to have to be embedded into those different business processes to make sure that we can help mitigate those corresponding cyber risks. So yeah, we're going to still continue to use biometrics. I mean, well, you mentioned the HIPAA regulations, even passkeys, which is really just a public-private key pair. There's various regulations around the world that haven't been updated to take into account the fact that, hey, now we've got passkeys that are more popularly being used, let alone biometrics. But yeah, I think the whole industry is going to have to adapt.
To that point, Frank, the passkey thing, and just I might take a little sensational opinion here. If you're still using password or cell phone text, SMS authentication for essentially getting into different back-end systems, you're already antiquated. To your point that you just made, effectively, is that most of the regulations out there haven't really even caught up with some of these basic ones, much less going to biometric. And even just using passkeys would make a huge dent in some of the AI-based attacks that are trying to replicate. Is this, like Kate, you said, is it a human? I'm actually kind of interested in Kate, your thoughts on this, because you and I have had discussions, specifically about how do you prove you're human. I want to toss it back to you and get your buy-in on this, or what you're saying. How do you prove you're a human?
I honestly think that's probably one of the better ways. I wonder though, so like Sam Altman and OpenAI, they have that orb now, and you're starting to see them in the cities where they actually take scans of your retina, and they're trying to build a case to be able to do that, for you to be able to get on, certain social media accounts, for you to be able to prove that you are a human, but it's translated to data. And so what I am curious about is that less secure than, some of these passkeys and what we're using right now? Or, are they taking those measures to be secure as well? And boy, what I think is that they always will innovate and then think about security on the back end. I fear that is probably true. But personally, and healthcare aside, I think about what's happening with the AI slop and what we're going to start seeing with emails that we get in droves because they're so easy to create, and social media accounts that are all AI generated that no human actually looks like. There's going to be so much junk out there that I would love. I'd be the first one to sign up for a social media that was generated by humans, validated that they were humans, and actually have that peer-to-peer connection, because I think it's just going to get so messy. But where I don't understand is, those retina scanners, those turns into, they turn into numbers. And so is it really more secure, or is it just an identifiable marker that can also lead to more fraud?
And just an odd beat on that is fully agree. A would love to validate, anything that is human, to interact with. Let's do it. But even on the regulatory side, even what Frank's saying, you take a look at Real ID, and that was initiated and passed as law just a few years after 9/11, and it took 22 years to implement. Everyone should have a valid driver's license. If we start going down regulatory path of saying validate, biometrics through retina scans, how long will that actually take? And I know TSA is using, the facial recognition stuff, which is actually pretty awesome, but just the standard stuff like, Real IDs, if lawmakers pass things, how long would it take to implement it?
Yes. I think longer than any of us would hope, honestly. So, all right. Fascinating. So actually, if I could pivot again to more of the wearables. So Frank, you reminded me when we were talking about insurance, and when, you mentioned the work that you did previously. As we are now seeing wearables come into the space, I'm talking about the little pins that, document data, the glasses that are, we're going to see more and more of those in the next 6 months to a year. How should we start thinking about our healthcare and privacy in terms of the wearables that are out there, the information they're collecting, and are we excited about them or kind of nervous?
It's all of the above, and from when the wearables and the watch and so on first came out years ago, various healthcare companies started to offer those as a benefit to their members. But what's the reason for that? And they think that if they have that additional data, they could get a little bit of better insight into, okay, well, what are the health risks associated with these people? Are they living a little bit more of an active or healthy lifestyle? Does that impact their corresponding premiums? So there are definitely benefits for both the healthcare provider from a healthy living perspective, but also the insurance companies in terms of impacting the premiums overall. So we're definitely going to be going in that direction. If we draw the analogy to the Google or Meta, and there are requirements from various parts of the world that our data can only be stored up to a certain amount of time. However, Google, to just draw an example, broadly speaking, they might not necessarily care about storing my data for an extended period of time. And they might delete it per various regulatory requirements. But what's important to them is they've already used my data to inform their algorithm to gather the insights from that data en masse. So the healthcare companies, it's going to be a similar thing. Now, how do we mitigate the various concerns related to this? Certainly, when ChatGPT first came out in November 2022, every CISO that I knew freaked out. Do we have the right policy in place? Are you using off-the-shelf AI solutions? Is somebody putting into the prompt some PII, some proprietary information, and so on? But many large healthcare companies are probably going to eventually go down the route of not only fine-tuning their own models, but also creating their own models. And if you store some PHI in the model that you train, well, how do you get it out? Well, I think we know we currently can't. You've got to retrain the model, which is an expensive proposition. So if we think about the mental LLM application architecture, is how do you fine-tune, how do you augment, how do you use retrieval augmented generation to do that? There are other parts in the architecture where you could potentially factor in some more access control to the data, maybe some more privacy protections to the data, because the underlying LLM themselves doesn't have it, but the application interacting with your vector database, hey, that could be a point in the architecture that gives you a little bit more control. So I think for us, from a security perspective, it's understanding how AI is being used for a certain business purpose in our organization, for research, for insurance, for care delivery, and then understanding, well, where in the architecture can we potentially include the appropriate security protections.
Yeah, to an extent, Kate, again, I'm interested in both of what you think here, but I just had a insurance update on my car, and even on that they said, it's a safe driving app for USAA, that they keep track of where I drive and how many miles I put in, and they use this to adjust your insurance premium. And I think this kind of model, obviously, where's this data stored? A lot less, worrisome on your phone and maybe potentially in their backend servers, even if it's AI based. That the obvious connection is would we potentially be able to reduce insurance premiums by being able to monitor your health more regularly, where the rings, the watches, and we already know these technologies have saved lives. That all of a sudden you're sitting at rest and your heart rate spikes to 150 and it says hey, you should probably go to the emergency room. But all that data that's stored there is still my question is, where is it stored? And it's fairly opaque. I do have an AI app, and I'm definitely leaning forward on this thought process, but I do a lot of preventative blood work. I do annual MRIs, and this all goes into a back-end AI model that I have access to on my phone. And I'm able to ask it, what are my health risks? What should I be doing? What supplements should I be taking? And it's, the amount of information I get is extraordinary. But as Frank, you're mentioning, is like once that data is in that model, like it's this analogy I always say, you can't unbake a chocolate chip cookie from 175 billion parameter cookie. There's one of those things, it's in there. You have to retrain the entire model, and there's this data risk that comes into it. I think from a personal perspective, all of these capabilities could feed into the healthcare system quite reasonably. The question is, how do we do it safely? And, Frank, you just went through all the technical side to it, but just from an implementation side, a lot of benefits that people will get from doing wearables. Kate, I know you have a few that you wear yourself, and sleep tracking and a bunch of other things.
Yeah, I do. But I would hesitate to give that data to a company quoting me for life insurance. There's something about that just doesn't feel good, although I feel like that is probably where the future is going. But I definitely see benefit in having, a wearable with you if you're trying to track, when you last took your medications, or, track your diet throughout the day, because that's no fun. And a lot of people are supposed to do that daily, or, taking it into the doctor's office to get a recap and a summary of what they said, because, you were nervous about what the conversation was. I see all of those benefits. But it gives you a little bit of the ick too, with all that they're getting in there. Frank, you had talked about these private LLMs. Do you feel it is better to have one massive connected ecosystem of an LLM, or do you still see the need to have more customized, private, unshareable? And again, I'm thinking of like health insurance as an example versus private information. Where does that draw the line for you?
We mentioned one potential mitigation from a slightly technical perspective in terms of the LLM underlying architecture. The other mitigation was kind of mentioned, but to explicitly state it, is to run a local model. Is don't run the model that's from the cloud service provider, whether that be one of the major cloud providers or even OpenAI or Anthropic or whomever it might be. An organization, a healthcare company could decide to, from an architecture perspective, run a local model using a tool like Olama, any model that they might then see the weights for and adjust the corresponding weights themselves. What we are seeing, though, is a trend towards kind of some amount of specialized models, not just one model to rule them all, but different models that might do a portion of pharmaceutical research better, might do a portion of actuarial analysis better, for example. And you might have a chain of corresponding models. And this is related to, of course, agentic AI agents that you kick off to not only integrate with different tools, but to kick off various specialized tasks. And piggybacking off of what you mentioned about wearables, we know one of the most popular creators of these wearables is Apple in terms of the watch, and AirPods are technically a wearable as well. And I think the general popular perception from the tech community is that Apple is behind from an AI perspective, from a Gen AI perspective. But if we look at the ecosystem, one potential advantage that they have is that they've got some of the most powerful devices in your hand, in your pocket. They've got a powerful chip built in from a LLM perspective that could be taken advantage of. So now you've got perhaps this private LLM functionality in your pocket when that does become effectively enabled. Now, we have yet to see that occur, but the infrastructure is conceptually there to make it happen.
Yeah, I like that thought. And that reminded me of the previous ransomware conversations that Mary was having, and I think even Brian earlier today. And if the less interconnected it is, I imagine the safer it is from ransomware. Is there anything with regards to ransomware that you feel like doesn't get brought up as much in the healthcare space, or anything that you really want us to start thinking about?
Yeah, that's a good question. Now, from outside of AI, we know that there's headlines all the time of organizations getting hit by ransomware. And a lot of the ones that do make the headlines of actually paying are healthcare companies. Now, why do they wind up paying? Well, without knowing all of the details of all of the companies that made the headlines, we can presume that they didn't have backups. They had no other way to get the data. And as was mentioned in a prior session, well, that also implies that they had immature GRC capabilities in terms of making sure that that process was in place. So AI might make it a little bit more effective in terms of kind of the attacker from a ransomware perspective. We potentially have AI to make it maybe a little bit more effective. Okay, tell me where in my ecosystem where I don't have effective backups, and where in my ecosystem do I have inappropriate governance to meet these worldwide regulatory requirements. We know one of the things that's definitely happening is that the complexity that a security team and a CISO has to deal with, it's getting a lot more complicated because of all of the various regulatory requirements. You need a whole team to understand. For example, NIS2 in Europe, how do they deal with this? Well, those requirements are set aside for the various countries in Europe to implement into their national laws. As a result, it's a haphazard, to be honest, implementation a little bit. So for me as a company, what does that mean? It means now I need to go figure out, well, who do I need to report to in all of these countries? Maybe I've got different divisions. I don't have just one European division. AI could potentially help understand that large bot. Go read me, AI, go summarize and identify the top things that I need to do from a governance perspective across all of these different requirements around the world.
Yeah. Rob, anything to add to that? Or I had a follow-up question for Frank on this.
The only thing I would add is just a couple sentences that I do believe the scale of ransomware attacks is still going to increase because of the ease of the creation of the attacks and the downward capabilities of where we saw ransomware as a service is going to be a lot, essentially going to translate into a lot less skilled individuals that are going to be able to create ransomware capabilities and target more bespoke healthcare organizations, even what we're talking about rural. And as it's in many cases life and death thing, and then these smaller entities do not even have a security team, much less a regulatory team to even do the capabilities Frank was mentioning, is that I do believe that the scale and the attack surface is going to increase as a result of AI enabling more of the attackers. The Anthropic report from 3 weeks ago does kind of dovetail into that thought process.
Yeah, for sure. And that sense of urgency, I think there are fewer industries that have that than healthcare in the space. Oh, Frank, you were talking about backups. Is this, when we're looking at NIS2 and GRC compliance, is that like bold, front and center? And I'm speaking of pure ignorance here because I don't know. Is that pretty widely known and regulated and something that everybody could and should be easily doing?
Short answer is ideally yes. If we think about all of the different capabilities, the various functions that every cybersecurity team in the world performs from an identify, protect, detect, respond perspective, and then recover, well, recover is the least mature one. If we look at the trajectory of security capabilities over years, over decades, we started with understanding our environment, then implementing various protective capabilities, and then detecting and responding. Recovery has always been a little bit more manual in terms of getting people involved in those things. So there is the promise, right, that we as an industry are getting better in that area. But hey, why do all of the organizations tend to make headlines? It's the technology is the easy part. It's easy to deploy a tool and push the button, push the scan button, and so on. The hard part is the people and the process parts of this, which is recovery tends to be focused more on those, which is, yes, what's made it harder. But yeah, we definitely, there should be a bright blinking red light on it saying that, hey, we need to focus on this.
Yeah, for sure. In the comments, Ray also mentioned ransomware is also paid to avoid sensitive data exposure, which when I think of that and I see how ransomware has been handled in the past, sometimes when you pay the ransomware, they'll say, okay, here we give it back. And then they'll pop up, 3-4 months later with that same data, always holding it over your head. What do you say to that? How do you speak to that?
Man, what a surprise. Turns out you can't trust criminals.
What?
Yeah. Now this is not healthcare, but there's other nuances to this in the sense of, we all know probably the well-publicized Colonial Pipeline attack. And at some point their CEO said, hey, well, we're going to pay the ransom to get the decryption tool. So they did get the decryption tool. It worked, but it was extremely slow. So it worked, but it wasn't practical. It wasn't feasible in terms of that. So they were able to recover in a different way, but it was just from the CEO's perspective, a tool, approach that he had available to him to try to recover as quickly as possible.
And Frank, that's, you mentioned the headlines. The thing that is often overlooked is that there's no follow-ups as to, okay, they paid the ransomware. Now what? Did it work? How long were they able to recover? How many of these systems they actually had to rebuild because they didn't have the backups, or the decryption didn't work as effectively as noted?
Yeah. Now, you mentioned something earlier. I'm kind of switching topics a little bit, but you mentioned the Anthropic report from a little while ago. I'm pretty sure you're referring to the Anthropic Threat Intelligence Report. And, we all perhaps have seen the headlines of vibe coding, hey, technology used for good in terms of getting some functionality out there. But then you've got attackers doing the same thing, the vibe hacking is what they called it, right? In terms of using the same tools for building malicious capabilities faster, more effectively, and sooner.
Yeah, that's essentially, you're basically, the ransomware as a service was a service because it was fairly difficult to build these capabilities and make sure the decryption works. The entire model of ransomware is based off of trust. And what I mean by that is that if individuals who pay the ransom are not given the decryption keys, and there's a lack of trust in that ecosystem, that you're basically saying, I'm going to pay this. Am I going to be able to recover? Yes or no? And there's, the brokers that go between here. So that's why the ransomware as a service, really cropped up, because they needed something that was reliable. It worked, that, there was trust built into this architecture. And what we might see is, because of, Kate, you mentioned it earlier about slop coding. Imagine what will happen to the entire trust ecosystem if people build ransomware capabilities and then it doesn't work from the recovery aspect. It could break the trust cycle and then really cause some irreparable damage, in which, the official ransomware attackers will say, hey, you could trust us, but this other, you could kind of see what might happen here by slop hacking, as you're potentially, I don't know if that's a new term we're just creating on this call right now, but you could see where this the trust has to maintain in order for the entire ransomware gambit and the financial transaction to be, make sense to both sides.
Yeah. There was a comment in here that, talking about no guarantees, like having a certified guarantee, that you'll get your stuff back. But
I'm a certified ransomware criminal.
That seems like a good idea. Oh man. So Rob, you were talking previously about all of the data that you store on your phone with your healthcare, and all of just the markers and the reports and the measurements that you do. There's been a lot of conversations about people that are using LLMs like ChatGPT to put that information in there and analyze it, and then come to find out, if you hit that little share button, you can search it on Google and it's not secure. Do you do that yourself? Or how do you recommend people interact with the data on, their ultra-human rings and all of the things that we're tracking?
Well, first of all, I think Frank already mentioned the best way to do it is, the infrastructure actually sits on your phone, and you can have it in a private repo. Now, granted, Heather Barnhart might be able to rip it out and do some fantastical stuff with it, solving crimes. But if it's private and you're intending for it to be private, not, there's no real share button on it, then that is a much more secure methodology. Where I think you're leaning toward is people taking, hey, the blood results, and then uploading it to a, even if they're on a pro subscription, they may be, embedding something in the training data, or they're sharing their output to a family member that says, here's essentially what it's telling me about my results, plus what this means and what I should do medically. It's now the new WebMD of taking a bunch of these different things and saying, analyze my output. And there's a couple dangers in there, just going back to not just healthcare, but the psychophancy of it's going to tell you what you want to hear in a positive way. There's some reports out there, and I didn't test it myself, but someone who says I have a pain in my chest, and everyone around them is saying, hey, you should go to the emergency room. That looks like a heart attack. It's like, hold on, let me put it in ChatGPT, my symptoms. I think I ate a bad pickle. What do you think your result of this, heartache that I'm finding is? Like, it's probably the pickle. You don't need to go to the emergency room. And that kind of bad advice, even from a safety perspective, is what we're now seeing over in therapy, and on both the bad and the good side, where people really depressed and saying, I want to, in my life, have that confirmation bias that the LLM would come back and said, yeah, you are really depressed. What is worth living for? And there's, clear accounts of that occurring where the LLM leans into your line of thinking, where it doesn't have that practical, neutral view. And I think a lot of folks, when they're using ChatGPT, don't even understand the simple bias that it's leaned toward to telling you what you want to hear. And again, this expands way behind the healthcare, but the biggest danger, I believe, is in healthcare therapy. People already are talking about using as their therapist, telling it it's, very private data. And even that stuff is sending up on public space as a result of using just ChatGPT, Anthropic, or Gemini.
And,
Yeah. Go for it.
So supposedly I'm supposed to know something about security, but this is maybe embarrassing to admit that just recently I learned that my Venmo transactions were all public, right? Because I didn't check the box because I didn't notice that little box was there to make them not public. And so who knows how many years of Venmo transactions are potentially searchable out there. But, I guess a variation on some well-worn saying, apparently, especially in this age, the cost of privacy is going to be some eternal vigilance. And, Rob mentions a key word here in terms of trust earlier. Who do we trust? I think we've also seen the headlines of, when OpenAI released GPT-5, they deprecated the 4.0 model, but then people were complaining about it because they felt it was warmer, more friendly. They felt it was a friend, and they had to re-enable that model. And so even though one thing that we don't quite yet have, but there's going to be this perception of trust or this perception of personality. And that's probably, I think, going to be some sort of differentiator, right? And how do we know that a doctor is good? Sure, maybe there's websites that review the doctor, but we don't necessarily go back and research, hey, were they at the top of their class? Are they the best surgeon or what have you? We think that they're a good doctor because she's got a good bedside manner, right? That's it. And that's kind of that bedside manner is what people were talking about. It was missing from GPT-5.
And where's the training data coming from for all this medical advice? Reddit, which seems to be number one.
I hope so.
Here's your treasure trove of medical advice. Hopefully there's a few doctors on there like dumping their minds into it.
Yeah, I can't even imagine being a doctor right now, where previously, they'd roll their eyes when you brought in the piece of paper thinking that you know what the diagnosis is, and now just how massive it's gotten. But when you're talking about how to interact with your personal data, would you recommend just don't do it? Because most non-technical people would say, you want me to do what? You want me to download a private LLM and then I have to train it and then I have to update it and then I have to do all these things? Is there an easy button that you guys are aware of?
I think people tend to treat their financial data and tax returns with more scrutiny and privacy than they do their healthcare data and private thoughts and, what's going on in their lives. And as Frank said, that the realism that some of the interactions tend to have, especially through these interfaces, are designed to create this interpersonal relationship. And so you're not going to hand your friend your tax returns, but in your private dining room, you actually might have a discussion about your healthcare. So I tend to believe there's this automatic elevated trust for healthcare data, but it actually, in my opinion, is a lot more sensitive in what it could be used for than many of your financial documents, which, most people have very similar, tax returns and, what they're potentially doing their deductions for if they have kids, whatnot. But your healthcare information does tend, for whatever reason, to be a little bit looser. And I think that's translated into utilization of some of these technologies, sadly.
Debates with some friends, and some friends are using various Gen AI services for personal advice and therapeutic type of conversations. And then some friends are on the other side of the spectrum. They're like, no way am I going to have that conversation with the LLM, because that data about my issues or whatever we're discussing is going up to the cloud now. And who knows how that's going to be used.
And well, again, I'd like to throw this back. Some of these technologies have been there for a long time. Like going in and being able to see someone's book orders on Amazon might be extremely telling. If you even get like that level of content and data that's out there. And of course, they're integrating all those historical things, like what do you buy for groceries? And there's always this, what is the story that of, family all of a sudden gets pregnancy things in the mail. And the reason why is, they ended up using their little shopper card from Safeway, and someone bought a pregnancy test and they find out it was their 16-year-old. And again, some of this stuff is just so streamlined of data utilization, but that's not even AI. That is just straight, data analytics and bringing it in. People are still shocked about the private information that they're sharing just voluntarily with these different organizations. And they are sitting on a treasure trove of this data. And people are clamoring for this training data that a lot of these private repos that they could turn around and sell. What is the, and again, it's tied to this conversation, 23andMe.
Yeah.
Ties directly into that. Like, what happens to your data that was sitting in there? What did you sign now that someone else might own the company? And will they use that as training data somewhere else?
Yeah, I was thinking of that example when you were saying that too, just how, a company in bankruptcy is now worth I think billions, depending on how much data they have available that others can use. Again, it feels icky.
Imagine what Netflix data is. I mean, and sharing an account, like, who started this?
Yeah.
Who's watching this? What is going on?
Well, and I think about, the kids growing up in this age, and they don't care because they don't feel like they need to care at this point, and how that is going to affect them as they grow older, and as marketing ads get so much more customized. It's a scary thought for sure.
I'm kind of curious because you've chatted with me about this too. It's the same question reverse to you specifically about healthcare data. What is your recommendation for folks? Where do you see, even in your experience? I'm kind of curious because you started the question. You haven't really answered it yourself. I'm very interested now.
Yeah, I am assuming that everything that I put in the machine is going to be searchable at some point, but I research a couple GPTs that I like and I use, and I will interact with those, and they will house my data. And if anybody wants to talk about my sleep markers or, my heart rate on certain run times, like, have a ball. But again, there will be certain fear when there's health risks, hopefully not. But if something comes up and then I no longer am applicable for life insurance, or, my premiums go way up because I'm, on X scale. So I basically, because I've been hanging out with you guys for 20 years, I'm scared of all the things, and I just assume that it's public. So, but then, there's a certain measure of things that, you take the risk because you want to know. But where I really get concerned, and something that you guys mentioned previously, is just these LLMs, they tell you what you want to know. And what does that do for our brains? And what does that do for, the way that we pivot and the way that we move through life when you've got a yes man hanging out with you, and it's only going to get worse?
So
just imagine when we've got our Optimus, our humanoid robot, hanging out with us all day, just chatting. It's going to be awful.
I'm going to go the other direction. I'm going to put it all into these AI services. If we think about a blockchain, that was the promise of a decentralized ledger. So we wouldn't have to rely on a centralized company. But then now, why do people use Coinbase, for example? Because they're worried about losing their wallet, because the hassle of managing it all on your own. And so similarly, most people are going to be using some centralized AI service.
Yeah. Convenience wins every time, right?
Is that the solution, to tell people not to do it to public ones and wait for the private ones, that could be doing it as a service? Or I don't know. How do we trust the service is done right?
Yeah.
I don't know.
Yeah, I think it's different from a personal perspective and from an enterprise perspective. Yeah. An enterprise could build their own internal LLM for their own treasured. Every healthcare company has their own treasure trove of data, like you were talking about, and they want to use that. They could use that for their own analysis purposes. So that's probably, they probably want to train their own model.
Yeah, for sure. Gentlemen, we've got 5 minutes left. Rich is going to come back with his Oscar music. What are some final thoughts? What are some last words? Is there anything that we didn't talk about that you think is, vital to get out in front of this audience?
I think Rob's frozen. I was waiting for Rob to go first this time.
Well, Frank's just shocked I'm not talking near as much as I normally do. He's like, it was not on his bingo card today. That's a great question. I honestly think that one of the takeaways is that people are leaning way too far forward on how they're using their personal healthcare data in the LLMs, just what we were mentioning before. And I think there's a lot of folks on here, even those in the healthcare industry, that have become a little bit lax on that. And I just, tell my friends and everything, just be really careful. Now, granted, having said that, I've, have my own AI capability that's analyzing my stuff, but that's a private service. And I'm hoping, going back to the enterprise side, tying these two concepts together, that they're following the proper security analytical models. But my risk reward here is going back to the original question we had, is the innovation of being able to monitor my results over time from a preventative basis. Like, it's even measuring the size of my brain. It's like, over the years, is it shrinking? Is it growing? And these type of things are incredibly useful to be able to track. From an innovative standpoint, that seems incredible. From a preventative, it could be life-saving, but then you're uploading your data into something that I have to have inherent trust in, that we know the regulations in the model security and even basic companies following that, we can't be assured of at this point. So I kind of tried to tie all three themes together. And I'm curious what you guys think.
Yeah, I'm going to assume that most of the people here on the session today are security folks at some organization.
Yeah.
So as a result, what's the personal roadmap for you, and by extension your team? Is, of course, one, we need to understand the technology. How is Gen AI, how are LLMs working? What are the various protocols under the hood? We mentioned RAG, Retrieval Augmented Generation, MCP, Model Context Protocol. All of these things you and your team need to figure out how they work, so that number one, figure out how they work, so that number two, well, you can start to secure it and then identify where you might need to put in the appropriate controls where possible. And then number three, I think the big differentiator, we talked about GRC, we talked about, hey, how do we think about these things from an organizational perspective? You're going to then need to think about, what's the suggestion? What's the business impact? Go see where your organization is looking to fund new technology initiatives, new Gen AI projects that are tied to some business problem, whether that, and then is it refilling prescriptions faster? Is it doing drug research faster? Is it providing online telehealth more effectively? If so, then go figure out, well, what are the bad things that can occur? What are the impacts? So is it prescription fraud, medical fraud, telehealth fraud, corresponding authentication issues? When I call up the advice nurse, how do I authenticate myself currently? Well, I give them my phone number, right? Pretty laughable. So as a result, right, you can go ahead and see, well, where's the biggest impact? And if you could help secure in a ideally seamless way without slowing down velocity too much, then that's going to help you win inside of your organization.
Yeah.
Any favorite free resources that you guys like?
Kate, you didn't answer your own question.
Oh, I didn't know I had to.
You do.
I think you both nailed it. One thing that I always think about, it's that US innovates, Europe regulates, and I'm just really thankful that we have each other, because I look a lot of what's coming out of Europe with the regulations, and just I am an optimist. I am excited for the future, but I am glad that security is top of mind in some of these places too.
That was a great way to end it, but you asked about free resources.
Yeah.
The Anthropic, the makers of Claude, have published they've been on a roll. So not only the threat intelligence report, but they published what they call their Anthropic Economic Index, that based upon all of the millions of prompts to Claude, what are the, not jobs that are being replaced, but what are the economic tasks that are most predominantly being done in Claude? And you can see the report of the differences around the world, what areas, what particular jobs. So it's not so much about job replacement and automation right now. It's about job augmentation in the current state of things. And even before you get there, in terms of that number one, understanding how this works, the Anthropic also has a very nice free prompt engineering class, a simple class about some basics of what's the structure of an effective prompt that you could utilize for any interactions with an LLM.
Oh, I love that. And with that first one, it's defining those use cases, which I think people really struggle with. And once you can see a set of them and then start thinking about them in your daily work, it makes it so much easier to figure out how to augment and get out of that AI is going to replace us all mode, for sure.
And by the way, Sans has some cool free stuff too that I'm going to let Rob talk about.
Yeah.
Yeah, just a couple beats. We have the critical AI controls that we worked in conjunction with OWASP AI Exchange. But, you know, there are different parts of OWASP. We have the OWASP LLM top 10. There's the OWASP AI bomb. And there's also an OWASP IR guide for LLMs as well. I would highly recommend, because we're working very closely with OWASP on a lot of these initiatives. Take a look at each one of those. But my favorite personal one is Kate Marshall's TikTok, in which she talks about a lot of AI use cases. No, it's true. A lot of the things I'm looking at use cases are actually, I pick up from Kate, and a lot of the back and forth I have with her. So, you know, just a head nod, you know, back to the efforts that she's doing, and keeps me abreast of a lot of these things. I didn't know about the Anthropic one, and I really appreciate that call out. I'm going to go read that today because I'm fascinated by that, Frank. Thank you. Yeah, and Kate, your resources right before we end with Rich.
Wow. My favorite resources, honestly, I go back to just ask your LLM and make it fight with you. So I will say, this is my opinion, or I'm looking for X, give me the point, give me the counterpoint, build me the prompt that will give me XYZ. I think that is how most users can interact with it to get the most out of it.